Guys, so in this chapter, we're going to learn about the development of teeth. So, interestingly enough, when the baby is inside the mother's womb, teeth development begins. So, it happens like before the baby is born, the primary teeth are already starting to develop as early as week 4, week 6, like it happens really early. Now, before we go into how the teeth develop, let's just look at parts of a tooth. So, when we're looking at teeth, here's one tooth. You can see the outer part is the enamel, the hardest substance in your body. It's the white part. Then we have the dentin inside, and we're going to look at what they all do later on. For now, I just want you to know the parts of the tooth. So we have the enamel. Underneath the enamel, we have the dentin. Underneath the dentin, we have the pulp. That's where all your blood vessels are. That helps you give feeling to the tooth. So sometimes if your teeth are hurting, it's probably because of the blood vessels here that's providing you some sensation. Covering the root, so this is the crown, which is on the outside. The root is inside the gum. Covering the root is the cementum. So there's like a layer of cementum that just covers the entire root. Okay, we have our gum. Underneath all the teeth, we have bone. But what we're going to actually look at is how do we get enamel? How do we get dentin? How do we get pulp? And how do we get cementum? When is all that formed? And so that's what we're going to look at. So let's start from the very, very basic. When a baby is starting to form, it becomes like it's like a germ layer. It becomes a germ, and they're in layers. So, and we kind of looked at this before, right? So we have the outer layer, which is the ectoderm, and the ectoderm makes the skin, also makes the gums. So inside your mouth, the gums is also known as your skin. Then we have the mesoderm, which is in the inside, and the mesoderm, it says here it makes muscles, skeletons, kidneys, reproductive system, but the mesoderm also plays a big role in making the inside part of your teeth. So like your dentin, for example, the pulp, for example. And then we have the endoderm, but we're not going to worry about that right now. So what happens is the outer layer, which is the ectoderm, okay, becomes the epithelium, okay, which epithelium basically means skin. So the epithelium, or in this case, I want you to think of gums, okay? So your gums are, there's a layer of gums. Underneath the layer of gum, we have mesoderm. So if you look at the cells in the mesoderm, we can call it mesenchymal cells. Okay, that's how the word comes from. So there's cells that are just underneath the epithelium or the skin or the gum. What happens is there's always talking to each other. So the epithelial cells that comes from the skin, that comes from the gums, and the mesenchymal cells, which is underneath, okay, that comes from this part over here, they're talking to each other all the time. And because they're talking to each other and they're exchanging information, that's how we can get a perfect tooth. Okay, so they have to talk to each other. There's also something called neural crest cells, and the neural crest cells, what they do is they also get in here. They also go into the mesenchymal cells, and they're talking to each other to make teeth. Just so we can understand this better, this is the fetus, okay, which will eventually become a beautiful baby. But when you look at this fetus over here, there's like this is the spine, and this is the brain, okay? So over here, where the brain is, there's something called neural crest cells, and these cells kind of go in, and these cells go over here, go into the mesenchymal cells, and they work together to make the tooth. So when we're looking at the epithelial cells, what does it make? Well, the epithelial cells is responsible for making the enamel, the outermost layer of your tooth, okay? And then the mesenchymal cells, which is on the inside, what do they make? They're going to make the dental papilla. The dental papilla is also will also make the pulp. Okay, so the mesenchymal cells will make the dentin and also really the pulp. And I'll talk about what dental papilla, we'll visualize it, we'll see what dental papilla actually looks like, but for now, just know that the mesenchymal cell makes the dental papilla, which will make the pulp. Okay, dental lamina. So you're in your mother's womb, you're probably like 4 weeks into development, or like anywhere from 4 to 6 weeks. And one of the first thing that happens in terms of tooth development is something called a dental lamina gets formed. So dental lamina is basically when you have the epithelium, so the skin or the gum, and the mesenchyme, which is the inner layer. They're interacting with each other and they make a sheet, and that sheet is known as your dental lamina. It's basically a sheet of epithelial cells. So it's a sheet of these epithelial cells, and then they're kind of gonna, dip into the mesenchymal area. And when it dips in here, this part like over here is actually known as a dental lamina. That when the sheet dips in and it makes that, it's the dental lamina. And then what happens is that dental lamina eventually it will give rise to a tooth. So a tooth will come out of it. And another thing that I want you guys to know is that this dental lamina eventually disappears and detaches. So this dental lamina will eventually disappear. This part over here will just like disappear so that the tooth can come out. So the dental lamina does disappear. So this is the mouth. This is the tongue right here. This is your gum or your epithelial tissue or your gum. And you can see that the dental lamina, or like a sheet of gums, is being pushed in and is soon going to give rise to, or is soon going to make teeth. Okay, so teeth are going to come out here. So there's going to be so many here on this side, so many on the other side, and same on the upper as well. And they're making primary teeth. Primary teeth are known as baby teeth. So buds are being formed, tooth buds, which is basically just like a blob, okay, of tooth, and then eventually it'll become a fully formed tooth. So let's recap a little bit. This is your epithelium. This is your mesenchyme. Sometimes people call it the ectomesenchyme. They're always interacting with each other. Then what happens is, this is like the dental lamina is starting to get formed because the epithelial tissue is just pushing into this area, the light pink, the mesenchyme, the ectomesenchymal area, and that forms the dental lamina. Okay, we're going to talk about the bud and cap later on, but that's what's happening so far. Now, what I want you guys to know is what's gonna happen from here. So what's gonna happen is that this, you know how the dental lamina or the epithelium, right, the gums, they got pushed in over here. Eventually it makes something like this, and it's known, this part, like the C thing that we're looking at, is known as your enamel organ. And the enamel organ will make the enamel. So the enamel will come out of that. We also have the middle part over here, which is right underneath the enamel organ. That is known as your dental papilla. The dental papilla will make the pulp and also the dentin. Okay, but pulps. Remember how I was saying earlier, I want you to know dental papilla, what does it make? It makes the pulp and also the dentin. And then this part, in light pink, that's just surrounding this whole part right here. So it's like circling the papilla and the enamel organ, is known as your dental follicle or dental sac. And what happens here? What will come out of that? The cementum, the periodontal ligament, and the bone. And we're going to look at what that is later on. But these are all parts of the tooth. Okay, so again, let's recap. The enamel organ, which is this part in dark pink, will become the enamel, the white substance of your tooth. The dental papilla, which is in brown right here, will become the dentin and pulp. And the dental sac or the dental follicle, two terms that are used to describe this, in light pink, will become other parts of the tooth, which are known as cementum, periodontal ligament fibers, and the bone. All right, let's move on. So we said the dental lamina, which is like the sort of gums, okay, gets pushed into the mesenchyme area. And what's going to happen is going to form buds, okay? So it's going to develop 20 buds lingual to the primary teeth. Oh, actually, look what it's saying here. The lamina develops 20 adult tooth buds lingual to the primary buds. So, in other words, what this is saying is the primary tooth buds, okay, which is your baby teeth, are over here, and right behind that, there's going to be adult teeth. So it comes lingual, which comes behind the adult teeth. Basically, comes behind the baby teeth. Now, what I want you guys to know over here is that the dental lamina is formed, okay? So the dental lamina is making these primary tooth buds or these baby teeth. And it's only going to make it for the incisors, the canines, and the premolars. It's not going to make it for the molars until way later, okay? So this is like the dental lamina, and it's only going to focus on the premolars, incisors, canines. The molars, okay, which comes out way later, it comes out from the general lamina, which is, okay, so this is like the dental lamina, and then the general lamina is where the molars come out, which comes out much later because, the fetus doesn't have that much space to make the molars, so that comes out later, and it comes out, just know it comes out from the general lamina. Dental lamina makes the primary teeth buds. Sometimes they call it, actually, I'll show you over here. This is where the tooth is going to come out of. Okay, so they're going to make the enamel. The tooth is going to come out of here. And what you're going to see over here, okay, so remember this is the enamel organ, is you're going to see an extension over here, and this is called a successional lamina. So this is your dental lamina, and this is a successional lamina. And what happens here in the successional lamina is that your adult teeth will come out of here. So there's going to be like 20 adult tooth buds just behind the primary tooth bud. So this is your baby tooth, and then what happens is right behind that, the adult tooth comes out. But remember what I said, the adult tooth will only come out for the premolar, canines, and incisors. For the molars, that is going to come out on its own. There's no successional lamina. They're just going to make a general lamina, and it's going to make the molars are going to come out from the general lamina. But from the dental lamina, they're going to make another one called a successional lamina, and that's where the permanent teeth, the adult tooth, will be made. Now, the way the teeth develop is what we call anterior posteriorly, which basically means the front teeth gets developed first, then the back teeth, then the molars, because molars get developed way later because the mouth doesn't have space for molars until way later. So anterior teeth get developed first, including the incisors, canines, and premolars. Molars get developed way later and posteriorly, all the way at the back. Now let's look at the stages of tooth development. So there's 3 stages that I want you to know. There's the bud stage. There's the cap stage. Oh, I just missed that. I'll show you. There's the cap stage, and then there's the bell stage. So let's look at all these different forms. So the way I remember it is B, C, B. Bud, cap, bell. Okay, so this is a bud. Remember, this is the epithelial tissue. This is your gum tissue. It's getting pushed in to the mesenchymal area, where the mesenchymal cells are, so the inner layer. So this is the outer layer, this is the inner layer, it's getting pushed in and it's forming a bud. Then what happens is you get the cap. So this kind of looks like a cap, I don't know, does it? Imagine your head just here and there's a cap. You know, your head is over here and there's a cap that you're wearing, so it's a cap stage. And here what happens is kind of concave, right? Kind of got dipped over here. So it's a concave lower surface. So it's given rise, it's going to become this part over here is going to become the enamel. And then this part over here, the dental papilla, is going to become the pulp. And the tissue that's kind of surrounding over here, I know you can't really see it, but what I'm trying to highlight over here, that is the dental follicle or dental sac. Okay, so it's developing more and more, and now we're at the bell stage. And so in the bell stage, okay, so now you can see a further dip. Right, the cap wasn't as dipped over here. There's a slight dip over here, slight concave, but with the bell, it's like further in, right? That dip gets extended into this area over here. Okay, so what do we see here? This is your enamel organ, and we have, this is called the outer enamel epithelium, because it's on the outside, and this over here is called the inner enamel epithelium. So we have an inner one, which is on the inside, and then we have the outer one, which is on the outer side. And they're going to help make enamel eventually. There are also cells in the middle, and these cells are called the stellate reticulum cells. So there's cells in the middle. They're actually, a fun fact, they're star-shaped. They look like a star, and those are known as your stellate reticulum cells. They're in between the inner and outer enamel epithelium. So in the bell stage, what happens is some cells will get developed. Okay, so now in the bell stage, this is when you're going to get enamel and dentin kind of starting to get formed. So if we look really carefully, so remember this is the cap stage. We just have a slight dip, slight concave surface here. This is the bell stage. And if we look really carefully at the bell stage, there's two different cells that I want to make note of. The first cell that you'll notice is ameloblast. Ameloblast is right over here. That's like this part right here. It's really hard to see, but these cells are known as ameloblast. And ameloblast makes enamel. Okay, E for enamel. So these cells are gonna make enamel. And then there's also another cell which is right underneath the ameloblast, and that is the odontoblast. And the odontoblast are gonna make dentin, D for dentin. Ameloblast makes enamel, odontoblast makes dentin, D for dentin, E for enamel. Okay, now the first thing that happens, yes, ameloblasts are out there. Then after ameloblast comes out, then odontoblasts come out. And then so we have ameloblast that's out there, that comes out first. Then we have odontoblast that comes out second. And then what happens is dentin gets formed, not enamel. Dentin gets formed. Even though ameloblast comes out first, which is for enamel, and then odontoblast comes out, which is for dentin, the first thing that gets secreted is dentin. So dentin gets, we'll see pictures of it, but dentin starts to get formed. And when dentin just gets formed, it's known as pre-dentin. And then it gets hard. And when it gets hard, which is after 24 hours, then it becomes dentin. So it's pre-dentin first, and then it becomes dentin. Okay, so this is what this slide is saying is dentinogenesis, so dentin. Genesis means formation, so the formation of dentin comes first. Then amelogenesis happens. Then enamel formation happens. So if we look over here, this is the bell stage, and the bell stage is usually two types. There's like the early stage, and then there's the late or advanced stage. And in the early stage, nothing has been secreted. Enamel and dentin aren't formed yet, but in the late stage, enamel and dentin are formed. So we can see over here, dentin is formed, which is in red. After dentin is formed, then enamel gets formed, which is in purple. Okay, let's see what we're seeing here. So again, this is a different image over here, but we can see, let's just review some terms we looked at. This is the outer enamel epithelium. We have the inner enamel epithelium, which is on the inside over here. So the inner enamel epithelium. We have the stellate reticulum, which is like the star-shaped cells that are in between the inner and outer. Right underneath the outer enamel epithelium, we have another type of cell, which is right underneath that, just as an FYI. It's known as the stratum intermedium cell. Okay, it's just underneath the outer epithelium. We have ameloblast cells, which make enamel. We have odontoblast cells, which make dentin. And you can see dentin in yellow has already been formed, not enamel, because dentin gets formed first and then enamel will get formed. This over here is the dental papilla, right? This is the enamel organ. This is the dental papilla, and this whole thing is called the dental follicle or dental sac. When you look at the dental papilla, you can see that blood vessels are starting to get formed. So blood is starting to get formed there because it's going to give rise to the pulp, and the pulp is where the blood vessels are, right? So the dental papilla will eventually become the dental pulp. Okay, you can see here, enamel and dentin well, you can only see dentin over here. Dentin is being formed over here. Then enamel. This dental papilla will become the pulp. Now what happens is when we look at the odontoblasts, so odontoblasts are the cells that make dentin, they start off really small. And then what happens is they elongate, they get bigger. These cells get bigger, the nucleus kind of gets shifted up as well, as we know that we can kind of see over here, the nucleus gets shifted upwards. And what happens is once it gets elongated, or what we call differentiation, which means it grows and it develops, the cell grows and develops, differentiates, then we can see that the dentin gets secreted. So there's dentin being secreted over here. So for the odontoblast to secrete dentin, the cell needs to elongate, needs to get longer, and then it secretes dentin. And the dentin gets secreted in increments. So in increments, what does that mean? That means it gets secreted in layers. So the first layer gets put, then the second layer gets put, and then the third layer gets put, and every 24 hours, the layers are getting hardened. So it happens in increments, and it's formed at the DEJ. DEJ stands for dentino-enamel junction. Junction is like where two areas meet. So where the enamel and dentin meet, that's known as a dentino-enamel junction, and it just kind of gets put down over here in layers. So dentin gets put down in layers. Odontoblast makes dentin, dentin gets secreted in layers. And so remember, it's called pre-dentin first. After 24 hours, it becomes hard, it becomes calcified, and then it becomes dentin. It is and when dentin first gets developed, it starts at the cusp tips. So if you have a molar, for example, remember the cusp is like the rounded mound that we have in our teeth. So premolars and molars would have cusp. So these cusp tips that we're looking at, it starts there. Dentin gets start there. So this is the dentin that you see, and then the dentin is there, and then the other layer of dentin will get formed, and then another layer of dentin will get formed. So these cells, known as odontoblasts, are just putting dentin in layers, okay? And it starts at the cusp tips. Once that's done, then you can see the once like one or two layers of dentin are put, then, oh, sorry, the dentin is right here. This is what I should be highlighting. This is the dentin. Every layer gets put. Then the enamel, which is in the lighter color, gets put. So dentin, maybe two layers of dentin, then the enamel starts to get formed. More dentin, more enamel. So you can see the dentin is over here, and then the enamel. Okay, so it's dentin, enamel, kind of like that. Okay, let's find some more stuff to talk about. So ameloblast, actually, let's look at this term, amelogenesis, which means the formation of enamel. So the ameloblast, what do they deposit? They deposit enamel shortly after dentin deposition has begun. So dentin is getting put in. Once a little bit of dentin is put in increments, then enamel starts developing or starts coming in. Now, amelogenesis have different stages, as we can see, okay? So there's like morphogenesis. Morphogenesis means these are cells, and the cells are going to decide what shape the tooth will become. Then there's organization and differentiation, which basically means that the ameloblast is going to grow and develop now. You can see, right, it's got kind of gotten bigger, and it's starting to develop. The cell is starting to develop and grow. Then we get secretion. So now we can see enamel being deposited. So secretion is where the enamel gets deposited. Then we have maturation, which is where the enamel is gonna get a little hard and matured, and then protection, where it's kind of stops. The process kind of stops. What you'll notice in the maturation stage, you can see when you look at the bottom of the cell, which is the ameloblast cell, you'll see that it's rough. Like there's like curves on it. But then at the protection stage, when it's done secreting enamel, it's smooth, just as an FYI. You'll also see that in the secretion stage, which is also known as the formative stage, so in the secretion stage where the enamel gets deposited in increments, you can see this like point, this conical kind of point. That point is known as the Tomes process. So if you ever see this word Tomes process, that's basically this point. So when enamel gonna get secreted, when enamel gets deposited, it creates this short conical process, or this projection that you see, and that's known as your Tomes process. Another word you might see in the textbook is known as terminal bar apparatus, which is basically these cells, they can connect to each other, and they connect to each other. This black thing here is kind of like you know the buttons in your denim jacket, kind of like that, like they connect to each other through buttons, and that is known as the terminal bar apparatus. We're going to learn about hemidesmosomes and desmosomes later. This is like a desmosome, which kind of connects cell to cell. Let's see. So when amelogenesis is completed, so when the enamel is completely formed, what happens is this protein is known as amelogenin that gets deposited to make it hard. The crystals of the enamel get hard. What else do we need to know? Yeah, so dentin starts at the cusp. Same thing with enamel. It'll start to get formed at the cusp and then it'll just get put down in layers. And the protein for enamel is enamelin. So enamelin kind of helps crystallize and just make the enamel. And for dentin, if we look at the previous slide, actually, I don't even have that, but basically, and you don't need to know this, but if you wanted to know, there are proteins for dentin as well, known as like dentin matrix protein, DMP. There's so many other ones, but that's all we need to know in terms of protein. Enamel makes enamelin. All right, so this slide is showing the deposition of enamel. So dentin is over here, enamel is over here, and it happens in increments, right? In layers. And you can see that the most inner one, the first one that got deposited, it becomes mineralized or hard. And the outermost is less mineralized. And every time things get or enamel get deposited, the inner one gets mineralized, and then soon the outer ones will also get mineralized. And mineralization will continue to happen, hardening of the enamel will continue to happen even after the teeth erupts out of the gum. Okay, let's look at roots now. So there's something called the root sheath. And what that is basically, so in orange you can see there's the outer enamel epithelium and then there's the inner enamel epithelium and they connect and they make, okay, they go all the way down and they're going to help you make the root or they're going to help us make the root. And that double layer of cells, the inner and outer enamel epithelium, that is known as your epithelial root sheath or Hertwig sheet. Some people call it HERS, the HERS, so HERS, but Hertwig sheet, epithelial root sheath, that's what it is, okay? It's where the outer and inner enamel epithelium join together and then they're going to help you make the root. Okay, so what happens is when this root is formed, okay, so sorry, when this root sheet is formed, okay, they're going to help you, there's going to be cells there. So there's going to be, let's look over here, there's going to be odontoblasts, and what the odontoblasts are going to do, remember odontoblast makes dentin? They make dentin in the root. And the reason I have this picture here is because we can see the dentin here and it extends all the way down to the root. So the root, which is this part over here, this is the crown, this is the root needs dentin too. Okay, so odontoblasts come from these, the root sheath, and odontoblasts are making dentin in the root. What happens after is that we know how we said, well, there's two layers, there's the inner layer and the outer layer of the root sheet. The outer layer makes cementum. And so cementum is basically a layer that just covers the root. And so cementum is made through the outer layer of the root sheet. So this outer layer of the root sheet right here will make cementum. So make the root. Odontoblast will make the root dentin. Cementum will be formed through the outer layer of the root sheet. The outer layer of the root sheet then goes away. I'll show you a better picture, and it becomes epithelial rest. So let me show you a picture of that. So this is the outer layer, right? And if you look at the outer layer, soon what happens is you can see the dentin is being formed. So this is the dentin, and so this is in the root. The dentin is being formed in the root. Once that's done, what you're going to see is the outer layer kind of disappears and it becomes epithelial rest. So it detaches from the tooth and it's known as epithelial rest. It has to detach. If it doesn't detach, if the outer epithelial or epithelium does not detach and does not become epithelial rest and it stays connected, then you can get some problems like enamel pearls, or there's other problems too, which we'll look at later on. But the outer enamel epithelium, that layer needs to detach and it becomes epithelial rest. This layer of the root sheet disperses and it forms epithelial rest. And you can kind of see that here. So you can see that sometimes some people call it the epithelial rest of molasses. Okay, so that's another word for it. There's a word called epithelial diaphragm, which is just this bend. So see how it goes all the way down and then it bends at 45-degree angle? That bend, when it is known, when the root sheath bends, it's known as the epithelial diaphragm. And this is the diaphragm is basically where the pulp will start to. You can see the pulp over here. The pulp will start to form over here, and it kind of creates an opening for the pulp, which we'll find a better picture later that I can show you. All right, so an interesting point is when the tooth begins the eruptive movement. So when it comes out of the gum, so this is the gum. When it comes out of the gum, you can see that as it's coming out of the gum, the root isn't fully formed. Like there has to be a nice shape to it. The root gets formed past, like even as tooth eruption is occurring, then the root is also like forming at the same time. So what I'm trying to say over here is that while the tooth begins its eruptive movements, as it's going up, the root still starts to grow. The root still starts to lengthen, and the root length increases. Okay, so it's eruption, but the root isn't fully formed, right? Fully erupted, and then the root is like probably fully formed. So it's as it's erupting, the root is still developing. So we were looking at the epithelial rest or the rest of molasses, and we know that the cells, okay, so remember that we were looking at mesenchymal cells, which is like the inner cell, and then we have the epithelial cells on the outside. The mesenchymal cells, they become cementoblasts. Cementoblasts make cementum. They secrete something called cementoid, which basically makes cementum. Cementum is the thing that covers the root. Cementum is what covers the root. So, when the root is being formed, cementum is also being formed on top of the root. Some teeth have multiple roots, like 2 or 3 roots, and so it starts off as like one root, but then it eventually becomes 2 roots or 3 roots. Okay, so it starts off at one, and then it can become 2 roots. Starts off as one, and then it can become 3 roots. So the moment it splits is when the furcation zone begins to form. So what is the furcation zone? Furcation zone is what you see in the arrow. It's like the split, like when the roots kind of start to split. That's the furcation. So furcation is the division of the roots. So we can see the furcation zone over here. And when you see the furcation zone, that's when the roots are really going to split off in its own ways. So primary teeth, they are developed in utero. So when you're in the mother's womb, your primary teeth are starting to form. The enamel, the dentin, all that is starting to happen, starting to form. The permanent teeth, they begin formation as soon as the baby comes out, so at birth or just even after birth. Now, primary teeth basically they stay in your mouth for around anywhere for 8.5 years. I mean, yes, you shed your teeth before then, but basically, let's look at how they got this 8.5 years. You have your baby teeth. They function. They do its job for at least 8.5 years. The first year, so when you're a baby, the crown and the root develops, so up until you turn a year. Then after that, for the next 3.5 years, or 3.75 years, the root starts to get really mature. The root really grows, right? Because when your primary teeth erupt, then your root length increases and it matures. And then you can even get root resorption, where what can happen is, and we'll learn about this later, is when when you get like loose teeth, and when it comes out, the root doesn't come out with it, right? Like it's just the crown that comes out. The root doesn't come out. And that's because the root gets resorbed. The root gets resorbed because the permanent teeth underneath is coming out and it's like resorbing the root. The root kind of gets resorbed. So all that, the root gets matured and then the root kind of goes away, happens for the next 3.75 years, and then it sheds, it falls off for the next 3.5 years. So if you add all this up, you kind of get 8.5 years. Permanent teeth or adult teeth, they are there for a lot longer. And when you are 12 years of age, you should have all your adult teeth in at that time. So at 12 years of age, all your baby teeth should be gone-ish, and then you should have your adult teeth coming in. Or all your adult teeth in except for your third molars. So We talked about enamel, we talked about how dentin forms, we talked about how cementum forms, but what we have not talked about is how bone gets formed and how periodontal ligament fibers get formed. So, bone is this, which is like formed around the tooth, and then between the root and the bone, or between the cementum, because the cementum covers the root and the bone, so cementum and bone, there is periodontal ligament fibers. So there's these lines that are connecting from the cementum to the bone, and those are called periodontal ligament fibers. So there are cells known as mesenchymal cells. So remember, we have the epithelial cells, and then we have the inner mesenchymal cells. The mesenchymal cells are, which is in brown, and you can see, are where the dental follicle is. Now, what happens is these cells, the mesenchymal cells, will become osteoblast. Osteoblasts make bone. Okay, so they will form bone. So bone will get formed around the tooth. And these mesenchymal cells will also become fibroblasts. And fibroblasts make these fibers, periodontal ligament fibers. So bone, what cells make bone? Osteoblast. What cells make periodontal ligament fibers? Fibroblast. There's also like osteoclast. Osteoclast with the C eats up bone, but osteoblast with the B, think of B for build, builds bone. Fibroblast, B, build, it builds fibers. Okay, so here we can see a better picture of the periodontal ligament fibers. Test question could be that the periodontal ligament fibers, like, where do they connect from what to what? And the answer would be cementum on one hand and bone on the other hand. So that's how they kind of embed to the cementum on one hand and to the bone on the other hand. That's how they connect. Alveolar process, also known as your bone, you can see it comes on so what it says is labial and lingual plates, which basically means labial means on the front, lingual means on the back. So you can see plates of bone being formed in the front and in the back, so labial and lingual. So let's just summarize everything we've learned here. So how did the tooth get developed? Well, first we have, this is cut off here, but this should say epithelium and mesenchyme. So in the uterus, we start off with just looking like this, right? Like it's like you have your skin, your epithelial layer, and then you have mesenchyme. These are cells. They're talking to one another, and then what happens is they become something called a bud, which actually this is the bud. Then it becomes a cap. Okay, so this is the cap, and there's something called enamel knot. Enamel knot is just formed like on top of the cusp, and it's like a signaling center that kind of gives tells you what shape the tooth should be, and it's just like a signaling center, and it dictates the shape of the tooth. So the enamel knot, that's what that is. So this is the cap stage. This is where you can see that concave dip happening. Then we have the bell stage where we see more of a dip happening, and here you can see a molar tooth is being developed. This is your papilla, which becomes the pulp, right? And then we can see dentinogenesis happening. So the light pink is dentin. Then we see after that is amelogenesis happening. The red is the enamel. So dentinogenesis, formation of dentin happens first, then amelogenesis, formation of enamel. Once that is developed, then the root gets developed. So once the crown is done, then the root gets developed. And this one is the last image that again just goes over the different stages: bud, cap, bell, then dentinogenesis happened, dentin formation, then amelogenesis, enamel formation, and it just apposition, which means just the layers of it just gets applied. So apposition, think of application. The layers just get applied, all the dentin layers, all the enamel layers, and then it gets erupted, and then it's fully erupted, and now it's functional. Now you can use that to eat and chew. This one also says the cap stage allows for proliferation, which means the growing, more cells are forming. Bell means differentiation, so the cell is growing. Dentinogenesis, we get the actual dentin being deposited. Amelogenesis, we can see enamel being deposited right here. So once the dentin is deposited, then the enamel. Secretory phase is the enamel gets deposited, and you can see this is the Tomes process, where you can see that conical like the cone shape, right? Maturation, so the enamel is now getting hard, and then protection, so it's kind of just like um, finishing off, right? So no more enamel is getting developed. All right, I hope that was helpful.